Hello, everyone. Thanks so much for joining us today for the kickoff of our 2024-2025 Language Access Presentation and Workshop Series. We are very excited to have you all joining us today. We appreciate you taking the time to be here. We did have a tremendous response to this series, and so we are watching people as they're coming in. So we still have some people joining, but we also want to stay aware of time and a lot of good information that will be shared out with you here shortly. So I don't want to take too much time away from the presentation itself, but do want to do some quick introduction and housekeeping items before we get started. So that being said, again, welcome to all of you. My name's Anthony Salas. I am the events director with Welcoming America. And as I said, just before we get started, a few quick housekeeping items for you to share. The webinar today presentation is being recorded, and we will be sharing this out with all of you and all other registrants in the next few days, probably early next week, I would say at this point, but we will be sharing it out with you. This, along with any resources that will be shared, will be coming your way along with that. In an effort to provide a secure and welcoming environment, any AI bots that do come in to record this session will also be removed because we are recording it and sharing it with you. So we want to make sure that that stays on focus for everyone. If you have any technical questions, please use that chat feature. You can use that for platform-related questions or anything related to the organization. You can also use it for any comments. If you have questions as the content goes on, there is also that Q&A feature. You can use that too. And then in a bit, as we get into the presentation piece, we will ask everyone, it looks like everyone, some of you are on camera now, which is great, but we will ask later on if everyone would consider turning their cameras on, and then also have a pen and paper handy. We will have some assignments and some work for you to do, so we want to make sure you're ready to go for that. So just want to make sure to mention that at the beginning as well. And so for those of you that may not be familiar with Welcoming America, just want to give you a little bit of information about us. We are a national nonprofit that leads a movement of inclusive communities that are working to ensure everyone belongs and are valued contributors to those communities. As an organization, our member network has a little over 300 members currently. We're made up of nonprofit organizations and governments from across the country. And the network members also do benefit from expert coaching, strategy planning, access to member-only events and resources, and a number of our communities of practice and programs like this one that you're a part of today. So again, for those of you that are not members, if you're interested in learning more about membership, I do encourage you to go to welcomingamerica.org. At the top of that page, you'll see a Welcoming Network tab. You can click on that and learn more about the network, and if you're interested in joining, how you can do that as well. So again, I don't want to take a whole lot of time away from the presentation today. So with that, I'm going to stop talking and turn things over to our amazing leader, if you will, of language access, Mary Jane McCullough. She's been a longtime partner and friend of Welcoming America, and has worked with me directly on these programs for, I think, 4 or 5 years now. So we've worked together a while, but I'm very excited to have her come back and lead us again this year. So with that, I'm going to go ahead and turn it over to Mary Jane.
Hi, everyone. Thank you for the lovely introduction, Anthony, and it's really nice to meet you all. Usually at the beginning of a presentation, I would spend some time having everybody introduce ourselves, but just in the interest of time and the amount of content we have, I'm just going to hop right in and I will introduce myself. And I hope that I will see a lot of you return throughout this workshop series over the next I guess 12 months, 8 months, 7 months, something like that. And we can all get to know each other over time, as has been in the case in past years. So in the meantime, a little bit about myself. I am Mary Jane. And as Anthony said, I've been doing these workshops with Welcoming America for, I think, 4 or 5 years. And I'm the founder and CEO of a language access advocacy organization and direct service provider in Pittsburgh, Pennsylvania, called Global Wordsmiths. I'm also a adjunct professor of applied translation and translation technologies in the Masters of Global Communication and Applied Translation program at Carnegie Mellon University. I'm an appointed commissioner on my city's Commission on Human Relations, and I sit on the board of directors of the Alliance for Refugee Youth Support and Education. Those are my kind of professional credentials, but on top of that, I would say I've seen language access from many different perspectives. I spent the first 15 years of my career as an interpreter, translator myself, and then later as an executive, a project manager, and doing many different roles within the language services industry. And I started advocating and doing this work about 7 years ago because I was just really interested in helping to build infrastructure to support people who don't communicate in English. So it's great to be here with you all. And a little bit about today's objectives. We have 1 hour together, and there's a lot of information, but we are splitting this workshop up into two. There will be two every month during this series over the next year. And today we're going to talk about the meaning and impact of language access, because I think it's important to ground this work in just understanding even, what we're talking about. And then recognizing the need for language assistance, which is, I think, its own practical skill that often gets overlooked. And then identifying a variety of different language access resources. And then next week, we'll get into how to use those resources, how to build some institutional fluency, and some more practical skills about, working with interpreters and using translation tools and things like that. But for today, I think, just grounding this conversation in what is language access, because this is a term that we are seeing more and more. This is an emergent field. It's always been a need, but it's something that increasingly, governments, organizations are paying a lot of attention to, and we'll learn why shortly. But, I like to think of it as language access having a number of different definitions, because it means a lot of different things to a lot of different people. So the procedural kind of boring definition is one, the legal definition is another, and then what language access is and means to people in their lives, I think, is another meaning of language access. To me, that is the most important one. But that kind of boring procedural definition is just, language access is what is achieved when individuals with limited English proficiency, or LEP, can communicate effectively with your program staff and participate in your programs and activities. Pretty straightforward. When I say this is the procedural meaning, I mean this definition is taken directly from the Department of Justice's lep.gov website, where a lot of the narrative and information about language access lives. But it's not the only narrative, and it's not the only way to look at it. One thing I want to bring up is the terminology that we use to talk about people in the context of language access. LEP, this term, limited English proficient, is also a legal and professional term that you will hear all over the place. I want to point out that it is a deficit-based label. We're identifying people as being limited in some way, in this case, in the basis of language or language fluency, and that's obviously problematic. Also, this term does have a place in the narrative because it's what's recognized across sectors. Government publications use this term. So you'll hear me use it, when it's contextually appropriate. But I like to just say people who don't communicate in English, because it doesn't matter why they don't communicate in English. It just matters that they have equitable access to services, resources, and information. So that's just something to think about. There are lots of terms in education law. We talk about English language learners, and they're all sort of problematic in their own ways, and nobody's really agreed upon a term that's the right term, because this is not a tunnel vision situation, and language access does mean so many things to so many people, and there's so many approaches to this work. So just wanted to bring that up because I think it's an important point. Now, what I think is the more important definition is, what language access means to people, right? So language access is access. You need communication. You need to be able to communicate. You need language to do just about everything. And without that support, you don't have equity. You don't have a situation where people who don't communicate in English have equitable access to resources, information, and services. And, these things are what make our daily lives tick. I think those of us who have never had to deal with being, not fluent in a language spoken in a country where we live, whether forced to relocate, whether migrating voluntarily, it doesn't really matter. I think it's really easy to overlook how often we need language, right, when we're interacting with these systems, services, resources, and information in the world. So I wanted to ask you guys just to kind of get the conversation going. You don't have to be on camera for this or anything, but what do you guys think are some situations that require the use of language, right? I mean, language access is equity in and of itself, right? Language access is integration. Language access is participation, and it's respect, right? I put some categories here on the screen: education, finance, food, medicine, right? These are big silos that we need communication for. But I'd love to hear from you guys. What are some situations, resources, information, services that require the use of language? What do you all think? Just to get you thinking about it.
Are we supposed to speak out, or are we supposed to?
Yeah. Speak out, drop it in the chat, whatever you think.
Well, the one of the big things that we encounter is parents getting their children enrolled in schools and interacting with the schools.
100%. Yeah, education. And it's not just, what's that? I'm sorry?
Social, neighborly social interactions.
Yeah. So education is a big one. We'll start with that. And it's not just, having access to education. It's being able to enroll your child, to understand correspondence coming home from the school, to have an IEP or a 504 that's fair and equitable. It's, being able to participate and integrate into the education process. It's also higher education and everything around education, like truancy laws and understanding that as a parent and things like that. And then neighborly services, like, just feeling welcome, being able to walk into a coffee shop and order coffee and feel like you belong there, right? And it's also not just about survival, right? Museums, parks, cultural institutions. What else? And Anthony, if you could do me a favor and read any that come in the chat, just anything at all. What do you think?
Like medical services, like hospitals, all the medical stuff.
Yeah, medicine is huge. It's like a medical juggernaut, right? It's not even just emergency care. It's, preventative care. We see much higher rates of preventable illness and disease in foreign-born, non-English speaking populations. Routine screenings like mammograms. We see higher rates of breast cancers, cervical cancers in people who don't communicate in English because, there's communication, there's health literacy, understanding the importance of screening as a concept, culturally, understanding how to navigate health insurance. Being able to even schedule an appointment is like a nightmare, even if you do speak the language. And then there's understanding the doctor when you're in the actual room, or being able to express what hurts or what's happening, giving birth, prenatal services, mental health. I mean, the healthcare scope is huge when it comes to communication. Anybody else want to share one more?
We had a couple of comments in the chat, one being job interviews and onboarding.
Yeah.
A couple of them mentioned that. We also had applying for public benefits, understanding eligibility criteria for those benefits, communicating with landlords, understanding rental agreements, submitting maintenance requests, things related to that. So
That's perfect. You guys don't even need me. You're absolutely right. These are all categories that require communication. And when you think about the impact of even one of these in somebody's life, right, it's huge. And so just from doing this in the past, I put down a few other ones, but each of these is just the tip of its own iceberg. And the ones I've listed here are just such a very few of the situations in the world in which you need to communicate, right? We have mental health, public safety, housing, emergency medical care, maternal health care, preventative health care, education, public utilities, public transportation, financial services, libraries and cultural institutions, professional services, daily navigation, just of the world, communicating with your community, shopping and meeting basic needs, government announcements, public benefits, social services, resources and connections, scheduling and phone, community norms, law enforcement, driver's licensing, home ownership, and it just goes on and on and on, right? And the reason I stress this so much during the beginning of this, relationship, this language access program that we're doing over the course of 1 year, is I think rooting ourselves in really understanding this meaning of language access to people in their daily lives helps us do this work from a place of empathy and true understanding that is really needed. So this workshop, Language Access Fundamentals, is broken up into two this month, this week and next week, where we're going to be talking about the basics. And today is really focused on just understanding the scope, recognizing what the resources are to help, and then just, getting on the same page about some of these basic concepts. And to do that, I do want to have one discussion. So I don't know how many people are in here at this point, but I'm going to randomly assign breakout rooms of 2 to 3 people each, so that everybody can come together and share a story of a time in your life when you felt powerless, couldn't communicate, or needed something and couldn't get it because of language or miscommunication. So I'm going to stop sharing for a moment here, and I'll give you an example just by telling you one of my stories. And of course, only share what you're comfortable sharing. And I would love when we come back for our breakout rooms for just maybe 3 or 4 people, or 2 or 3 people even, to share their own experiences so that we can start to think about this in context. So I always like to use a funny, really silly story about when I first moved to Mexico City 23 years ago, which is crazy to me. And I barely spoke Spanish. And Mexico City is huge. It's like 24 million people. Everybody there is really, really cool. And I was like really intimidated, and I felt like I didn't belong there to begin with. And I was having trouble with the language. So I already felt like underconfident. And I went to this party with all these super hip people. And I was trying to tell people that I was embarrassed by my Spanish. And I was using the word embarazada to say that I was embarrassed by my Spanish. And embarazada is a false cognate. It actually means pregnant. It does not mean embarrassed. So I was walking around a party, drinking beer, telling everyone I was pregnant. And they were like, whatever, lady, you do you. I kind of was like, why doesn't anybody like me? And then somebody finally told me, like, hey, that word does not mean what you think it means. And I had a good laugh. I was able to laugh at myself in the situation, and everyone thought it was cute and funny. But underneath, like, laughing at myself, I felt stupid. I felt super embarrassed. I was ashamed. I wanted to go curl up in the fetal position in my little apartment and cover and pull a blanket over my head and go home. I felt like I didn't belong there. I felt exposed. I felt vulnerable. I felt all of these really complex feelings. And in my case, this is a situation where I was there by choice. I had financial resources. I had a support network, and I was at a party. So it wasn't like I was trying to connect with vital services. And so please take just about 5 minutes in your breakout rooms with your partner or your small group to all talk about your own little situations like that. And I want you to focus on thinking about how it made you feel. So in my case, that shame, the embarrassment, the stupidity, the wanting to go home, feeling like I didn't belong. I want you to try to zero in on those feelings. And, then please, if some brave people want to share their own stories and talk about those feelings, that would be very helpful. So, gonna set up these breakout rooms now and get it down to 2 to 3 participants. I'm going to create them randomly. And like I said, you'll have about 5 minutes to talk about this question of a time in your life when you didn't feel understood or like you had a voice or like you could communicate or access things as a result of language. So here we go. And I will see you all in 5 minutes. Okay. So everyone's back. Thank you so much for being willing to talk to each other and to me about your experiences. Would anybody like to share a story from their life and how it made them feel? Or is anyone willing to share a story from their life and how it made them feel to help me out? Anyone? There has to be somebody who in their life has felt like they couldn't communicate and has a story to share. No?
Mary, I'll save you and share a story.
Thank you. I appreciate it.
So one of my first experiences with embarrassment, shame around language access, some years ago, 15 years ago, I was studying abroad in France. And one of the requirements to participate in sports was to go to the doctor to get a physical. And at the time, I spoke some French. I spoke enough to get by. But I remember being in the doctor's office, having to go through the registration process, seeing the doctor, getting a physical exam. And I didn't really speak enough to understand all that was going on and what was being communicated to me. But for some reason, I really felt embarrassed to ask, do you have an interpreter for English? Like, do you have any translated materials for me so I can better understand? And I just really remember being fearful and thinking, I need an interpreter, but I don't really have the words to ask for one. And, maybe it'll just be okay. I'll just get through. And so that's, I guess, experience I lean on as I help clients now, make sure that they know their rights, and make sure that interpretation, translation is offered to them when they receive services.
Thank you so much for sharing that, Eli. And I'm sorry that you had that experience. But those are some great insights and exactly what I was looking for. So thanks again for saving me. And I'd love to hear if anybody else has a story. I'd love to get a couple. And I've done this discussion probably 100 times. I think this is the first time ever that I haven't had people volunteer. And so if truly nobody wants to share, I can move on. But I think it's more beneficial if we can get just one more person. No? Okay. Well, go ahead.
Yeah, I couldn't find the raise the hand. I don't know.
Oh, I'm sorry about that.
Find it, but I don't know why it's not showing up on my screen. Oh, it's probably under more. Sorry. It's embarrassing. It's really embarrassing. It was over 40 years ago, so it was before there were a lot of bilingual things when you travel to other countries. And I was on a flight to the Philippines, but I got to Japan first. And it had been a long day. We flew through a typhoon. There was, it's a very long process. And I landed at the airport looking for the hotel to stay overnight before I caught my next flight. And finally, after asking so many people, I finally found like an information desk. And I showed her the paperwork and I was, asking what to do. And she just starts talking. And then I just said, I'm sorry, is there anyone who speaks English? And she said, I am speaking English. But it was so heavily accented, I had no idea what she was saying. And I was the ugly American. I said, can you please speak it better? I can't understand anything you're saying. And it's always embarrassed me all these years later. And so certainly makes me have more empathy. And when I travel, if someone seems to be struggling, I speak a few languages. And so I'm able to help people like, do you need some help here? Just because I know how awful the feeling is. And when you're exhausted and so spent, and the frustration builds very quickly.
Yeah, it does. And especially because this was so embarrassing for you. Thank you for sharing it in the space of new people. But definitely you're not alone and you're not the ugly American. And I think we can all relate. So thank you again. And I have Kareem, I have one more hand up.
Yeah, very quick. I want to share a story. It's a drama a little bit, but one of my very close friends work as a real estate agent, and usually he go to show apartments for people who are interested and so on. So one time he went to the apartment and was waiting. The apartment was empty and waiting for the person who is coming. And suddenly the police break into the apartment, and it seems one of the neighbor called saying someone is in the apartment and put him on a gunpoint.
Jeez.
And he's a migrant and his language is not the best, and the language here was just life or death, if the officer didn't understand him well. Or if he didn't understand the instruction well, it will be bad. But yeah, it ended up in a good way, but it was trauma. He's still remembering it till now.
Wow. I'm really glad your friend is okay. And thank you for sharing that. And I agree that it's traumatic. And I just want to point out before I move on from this activity that just in this short discussion where 3 people and 4 people, myself included, shared stories, we shared the following feelings and words: embarrassed, ashamed, stupid, don't belong, want to go home, humiliated, can't understand, fearful, need help, no words to ask, I'll just get through it, can't find help, misunderstood, awful, exhausted, spent, frustrated, life or death, and traumatizing. In this exercise in the past, I've also had people say things like fear, isolation, anxiety, nervous, lost, lonely, intimidated, exhausted, depressed, unwelcome, and unwanted. And so those are big feelings, and they're sad feelings, and they're hard things to deal with, especially on top of becoming acclimated to a new place, learning new systems, integrating into a new culture. So I want to throw up this slide again really quickly with just the tip of the iceberg of the situations and services that we need language for, right? Mental health, daily navigation, scheduling things, social service, public benefits, healthcare, housing, education, driver's licensing, et cetera, et cetera. It goes on and on and on. And I want to repeat some of these words again, embarrassed, ashamed, stupid, fearful, needs help, no words to ask, traumatizing, don't belong, unwelcome, exhausted, misunderstood, no words to ask, fearful, nervous, anxiety, lost, humiliated, ashamed, embarrassed, stupid, right? Can you imagine feeling some number of those feelings, or even one of those feelings, every time you try to act with any of these services, right? And so I know that I'm really driving this point home hard, but I want to set the tone for that meaning of language access. What it means to people is this, right? What it means to people in their daily lives is whether or not they're able to interact with these services, whether or not they can integrate. And I don't know, what do you guys think happens if every time somebody tries to schedule a doctor's appointment or, communicate with their kid's teacher or report a hazardous condition to their landlord or, use a library, every time they try to do that, they run up against feeling like that. What do you think people do? What do you think happens? Anyone? They stop trying, right? They stop reaching out for services. They stop making an attempt, and people self-isolate into their communities where things are a little easier, where they can communicate with people. And so that means that a lot of us who are doing nonprofit work, government work, we're not even seeing the need, let alone being able to service it. So that to me is the most important definition of what language access is. And I want to do just a quick overview of some demographics and of the legal definition, and then we'll start talking about some more practical skills. So in the United States, people who don't communicate in English, there are about 68 million, or 1 in 5 people who speak a language other than English in the home. And of those, about 25.5 are considered quote unquote LEP. And we have more than 350 languages spoken in the US today. Now, this data is, more than 2 years old at this point, and we know that LEP populations are very difficult to count. So the real number of LEP individuals living in the United States today is much, much higher. And one of the reasons LEP populations are hard to count is because they're not reaching out for services. They're not showing up on census info. And even if we control for that when we put our data sets together, it's still really easy to miss just how many people there are who have trouble with this. We saw in the only formal research study done recently in the increased rate of LEP population in the US from 1993 to 2013, there was an 80% increase. And in the 10 years since then, it's increased even more, though I don't have any actual data to show that. It's pretty, we can see it, right? We know that there are more people coming in and living here who don't speak English or don't communicate in English. We also know that compared to people who do communicate in English, those who do not tend to have less access to education, and they're more likely to live in poverty and experience poor health and education outcomes overall. Right, so that's not good for anybody, and it's really clear that language access is important to everyone. The last little definition of what is language access, it's also the law. Most people are familiar with the Title VI provisions of the Civil Rights Act, but also there's legislation written into the Affordable Care Act, the Americans with Disabilities Act. There's an executive order called EO 13166 that clarifies what people need to do. And then I'm also a big proponent of looking at the US Constitution, because constitutional law tends to be something that people are more fervent about defending. And the 14th Amendment was actually what was used to enforce language accessibility up until about the mid-1970s. So language access has all of these meanings, but it's important to also understand the terminology and the facts as we move into this language access program. So I think some people in this group probably have some, understanding about language access, but just to get on the same page, interpretation versus translation, basic vocabulary, it's okay if you didn't know this before, most people do not, but they're actually totally separate disciplines. Interpretation is spoken or signed, transfer of one language to another, and translation is written. They're totally separate, fields, they're totally separate skill sets that you need to be able to do this. Interpretation, you need a high level of fluency in both languages and the ability to think quickly on the spot. Whereas with translation, you can use dictionaries and do research, and it just is, it's a different part of your brain that you use altogether. And so a lot of people, I think, conflate these terms, but understanding what they are and then what the resources are within language access within the field can help you decide which resources to use when you need to use them. And so the most common ones that you all will probably see in your work would be phone interpretation, which is a silly name, but in the industry is called OPI, stands for over the phone. It's kind of a terrible name, but here we are. There's also video remote interpretation, which is also called VRI. And there's in-person interpretation, which is kind of the gold standard. And then you have written translation. And under the umbrella of written translation, you have a ton of different resources and tools and modalities. And it's the same with interpretation. There are more resources than this, but these are the most common ones and the ones that we're going to learn about this week and next week. Over the phone interpretation, or OPI, is a very, very common resource, and it's one thing that you can certainly use. I like to think of language access as having a whole toolbox, and I like to take a holistic approach where you have lots of different tools that are appropriate in different situations. Phone interpretation is awesome, and it is totally appropriate in many situations, but it's also very inappropriate in other situations. Quality control is a pretty serious issue because most phone interpretation providers outsource to networks of people who aren't trained. They're paid pennies on the dollar. So they're taking calls while they're in the car, while they're cooking dinner for their family. They don't have formal training in interpreting, and a lot of problems can result from that. It's not really appropriate to use OPI for this reason and others. For anything vital or meaningful, lengthy, anything specialized, right? But it's a really great tool to call somebody and remind them about an appointment, for example. A lot of the nonverbal cues are also lost, like the interpreter doesn't have the context of the room or of what's happening. And so the accuracy can be very poor. But it's also quick and convenient and cost effective, and you can access it anywhere, anytime, as long as you have a cell phone for the most part. So OPI is one of the big tools that you'll have in your language access toolbox. And we're going to talk more about the language access toolbox too. And again, apologies for those of you who know the basic stuff. You know, it's always hard to know what the baseline level of knowledge is in a group. But machine translation is another one, and especially with large language models and AI, it's something that's increasingly being used to communicate with people. But just like phone interpretation, there's an appropriate time to use it and an inappropriate time to use it. And there are also appropriate ways to use it. Because, you know, as good as AIs are and what's called neural machine translation, you know, meaning can be lost if there's no way to incorporate context. So if you're using a large language model, you can get really particular with the questions you ask it to control the output. But most people don't know how to do that or don't do that. And so they'll just input text and say, translate this sentence. And then when they get back, has no context at all, because machines don't actually learn, right? They use information that they already have to make decisions. The quality of translation is really dependent on the language pair when it comes to machine translation. That's because there's a lot of training data out there in what we call high resource languages like Spanish, Chinese, Arabic, Russian. But for lower resource languages, which is also not a great term, like Kinyarwanda or any of the Bantu languages, Nepali, even Vietnamese, which is a very common language, the output quality is actually very poor. And there's no way to know that if you're not controlling the process. Also, you have to customize, or the accuracy of most machine translation systems is really dependent on how it's customized or the questions that it's asked. And human translators are really still needed to verify, to make sure that the text is in the right place. If you're copying and pasting machine translation that's in a right to left language, for example, like Arabic, you paste it into a document, oops, it's going to justify the text and display it backward and not actually implement it from right to left. So you just have to be careful with how you use it. And just the phone interpretation, machine translation is best for, you know, sending a reminder, sending a note to somebody, you know, a text message perhaps, but you don't want to use it for, like, I don't know, healthcare, prescription medication instructions for a child, or, you know, something like that. So I want to talk about, before we do one little last activity today, the fact that, understanding the definition of language access, you guys got it, probably already know most of the resources that I told you about. And now, like, getting more into the weeds with practical skills, recognizing when you need to engage language assistance resources is also a skill itself that needs to be developed. Because sometimes people will say they don't need an interpreter, or sometimes it will seem like they don't need an interpreter. So people won't even think to ask. But in reality, it takes a lot of cognitive load to process information in a language that's not your first language. And just like the example that was given in the project we did, where the young man, I forget your name, but you said that you knew you needed an interpreter at the doctor, but you were afraid to ask for one. That happens to people here in the United States all the time. Or people maybe don't want to be a burden. There's often family pressure to use family members as interpreters, or they think they understand more than they do. And that's a slippery slope, because who are we to say, no, you need an interpreter, if people feel that they can handle it without? But especially if we're doing government work or healthcare work, we do have to make hard decisions, and maybe sometimes say things like, well, it's the rule that we have, or, it would be better for me if we have an interpreter, or coming up with some kind of a script to tell people that you would feel more comfortable if there was one present. Some people will decline interpreters because they're afraid it'll be held against them, or they're worried about confidentiality, right? And there are a number of reasons why people will not express to you directly that they need language assistance. So it's up to us to hone the skill and develop the skill of being able to recognize, hey, I need to use, an interpreter here, or, I'm going to get these documents translated because it just feels like the right thing to do. So in the interest of time, I'm going to also just quickly let you know that another external factor is that if somebody is sick or going through a hard time or aging, it's even more difficult for them to communicate no matter what language they speak, and somebody's ability to communicate in a different language might decline, even if otherwise they do a pretty good job with it. So be on the lookout for those things. If somebody looks like they don't understand you, or seems like they don't understand you, maybe they're not fully answering your questions, they're not really looking at you, they're answering yes to everything, or they seem distracted, that might be a cue that you need an interpreter. So to drive this point home, I'm going to ask everybody to get your pencil ready and a piece of paper. And we're going to do a really quick, really fun activity that really highlights the importance of this and how important it is to engage other skills for even determining if you need to use language assistance resources. Because making assumptions is something that sometimes it's obvious and you can make the assumption that an interpreter is needed. Like if it says on their chart or in their file, this person needs an interpreter, it's really obvious. But, making assumptions can be dangerous in other situations. And this is a really fun activity to express why that is. So does everybody have a pen and a paper? Great. Well, then I am going to pull up a form in my slides. And I want you guys to pretend that you are, somebody who's lived in the US for a couple years, and maybe you have a decent level of understanding of the English language and you're able to communicate pretty well, and you're trying to sign up for a benefit or enroll somebody in school, or you're filling out a form for some kind of an intake, and the form's in English, and you're like, okay, no problem. I can do this. I understand this. It's not a problem. And I'm going to show you this form, and you're going to have 3 minutes to complete it. And I'm going to read you some instructions, and you'll have to follow the instructions and complete the form in those 3 minutes. And then we'll talk about it, because it's not as easy as it seems. So I'm going to share again, and I'm getting ready to read the instructions. Yes, it's supposed to look like that. Don't worry. And the instructions are as follows. To fill out this intake form, you have to write from right to left. the answers have to be very clear, because sloppy writing will be discarded. You have to fill in every blank. For number 2, you have to use the Islamic calendar, which begins on July 16th, AD 622. You have 3 minutes to fill out the form, and you're not allowed to ask any questions. So I'll read those once again, and then you'll have 3 minutes. You have to write from right to left. You have to write very clearly, to fill in every blank. For number 2, use the Islamic calendar, which begins July 16th, AD 622. You have 3 minutes to complete the task, and you're not allowed to ask any questions. Okay, so go ahead. The 3-minute timer starts now.
So just to clarify, we answering like we writing our names, dates, stuff, right?
One of the rules is that you're not supposed to ask questions, and that helps make the point. So I'm sorry.
Oh, sorry.
It's okay. Okay, we've got about 1 minute left. Okay, so how did that go for everybody? Was anyone able to finish the form?
All but number 8.
Okay, pretty good. Anybody else? First line. I like that. So what was hard about this for folks?
I needed some clarifications, but yeah.
Well, imagine not being able to ask for those clarifications, right? And even if you come into somebody's office and you're speaking English and people think you're good, but then you get the actual paperwork and you need to clarify things that are complex and there's nobody there to help. That's kind of one of the reasons I love this form activity so much, is because it really kind of puts you in that mind state of like, okay, this looked familiar when I looked at it, but actually it's really difficult, right? And I think that really sets the tone for why we need to do the work that we do, why it's important to engage language assistance resources, why it's important to know what those resources are, and why it's important to engage with them and know how to do it appropriately. And that's what next week's workshop is going to be all about. Even the thing, the Islamic calendar, right? A lot of people from, Middle Eastern countries do use the Islamic calendar. And so they've got to readjust to a whole new calendar system when they come to the United States. One of my students is a Syrian woman in her 50s. And she was like, this is great. This is easy for me because I've been racking my brain, trying to adapt to the Western calendar for the, 3 years I've been living here. So that was a nice break for my brain to be able to just use the calendar I'm used to. Or in Romance languages where we do, in English, we usually express the date as month, day, year. Spanish, French, Portuguese, Catalan, Italian speakers usually express the date, day, month, year. And so if something is scheduled on May 5th, somebody might show up, on April 4th, or if something's scheduled on May 4th, they might show up on April 5th, because the date and the month are reversed. So thinking about these things, they're all practical skills that are important. And next week, we're going to actually talk about how to work with interpreters, where to sit, who to make eye contact with, how to be effective, right? How to commission a translation, culturally appropriate techniques. And then we're going to do a workshop about institutional fluency, about how to incorporate some of this in the work that you all do on a regular basis. So thank you so much. It was great to meet you all. There's not a whole lot of time for questions, so I hope that I'll see most of you next week, and I'll let Anthony wrap things up today. And if anybody does have questions, please feel free to email them. Anthony knows how to reach me. And like I said, next week we'll have more of a discussion and a workshop.
I think Mara had her hand raised. Mara, did you have a quick question?
Well, I did. It was one time I worked in public health. We worked so hard to put together brochures in Spanish for bronchopulmonary dysplasia. It's something that a lot of preemies have. And we produced all these things, we got them out there, and then we realized that the clientele we were trying to reach was illiterate. They couldn't even read. So we didn't even know the audience. We thought, oh, easy, we'll just make it in their language. And we totally missed the mark. So I just wanted to put that out there because that's a possibility.
Yeah, that's a great point. And we're going to talk, when we talk about that culturally appropriate technique and how to use language access resources, knowing your audience and doing some research about who your audience is really, really crucial to getting it right. So I appreciate that you brought that up.
Great. And before we head out to you, just a quick reminder, the next workshop is next Wednesday, September 25th. It'll be at 1 p.m. Eastern Time. The link that you used to join today, it's the same one. So you should have that. But if you do need it, when I do send out the recording of today's session, if you need the link again, just respond and let me know. I'm happy to share that with you. But otherwise, thank you all so much for joining today and participating. We're excited to kick off this next series and look forward to seeing you all next week. Have a great rest of the week and your weekend, everyone. Take care. Bye-bye.
Bye.
Thank you.
Thank you. Bye.